Any bleeding after menopause is scary, and most women are either told to panic or told to ignore it. Here's the truth. Post-menopausal bleeding is common, usually explainable, and absolutely something that deserves evaluation, not necessarily fair. And today I'm walking you through the 3 most common reasons women bleed after menopause and exactly when it is and is not an emergency. Now, there are always far more reasons, but these are the 3 most common. So before we dive in, hit like and subscribe. It helps this content reach more women who are searching for answers. I'm Dr. Rebecca Hertel. I'm a board-certified osteopathic physician and a menopause practitioner and founder of Osteopathic Midlife Health, where we care for women virtually across multiple states. And so if you or someone you love has experienced bleeding after menopause, this video is for you. So what counts as postmenopausal bleeding? Postmenopausal bleeding means any vaginal bleeding that occurs after 12 consecutive months without a period, right? So you've gone 12 months without a period, and then all of a sudden you start bleeding. So that includes spotting, pink or brown discharge, bleeding after intercourse, bleeding that only happens once. And no, it's not normal, but it also does not automatically mean something horrific. So vaginal and uterine atrophy, meaning thinning of the tissues. So this by far is the most common cause of postmenopausal bleeding. So after menopause, estrogen levels drops, and that estrogen is what keeps the vaginal, vulva, and uterine tissues nice and thick and elastic and well vascularized. And without estrogen, those tissues thin, blood vessels become fragile, micro tears occur easily, and this can cause things like spotting after intercourse, bleeding with wiping, recurrent UTIs, burning or irritation, vaginal dryness and discomfort. That is called the genitourinary syndrome of menopause. But also when the uterus is thin, that can cause bleeding as well. So cause number 2, endometrial polyps are benign growths. So the second most common cause is benign growths inside the uterus, most commonly endometrial polyps or fibroids. So polyps are estrogen-sensitive tissue growths. They can develop even after menopause. Often cause intermittent spotting, are usually benign, and bleeding from polyps often. They come and go, and it's light. It happens without pain. It occurs unexpectedly, and diagnosis usually involves things like a transvaginal ultrasound, sometimes a hysteroscopy, but most polyps are not cancer, but they should be removed and evaluated. Endometrial thickening or hyperplasia. Now, this is the cause we take the most serious, but it's still far less common than women fear. Endometrial thickening can occur due to unopposed estrogen exposure, obesity because adipose tissue produces estrogen, certain medications, hormone therapy imbalance. Those symptoms could include persistent bleeding, heavier bleeding, recurrent spotting, and this definitely needs evaluated. Some causes are benign, but some are precancerous changes, and a small percentage represent cancerous changes. Again, ultrasound measurement of that endometrial thickness or stripe, endometrial biopsy when indicated. Early detection matters, and outcomes are excellent when caught early. But what about hormone therapy? Yes, bleeding can also occur when starting hormone therapy with dose changes and with inconsistent progesterone use. Some bleeding early on can be normal. We usually say within the first 3 to 6 months, but any bleeding after menopause still deserves evaluation, especially if it persists. So sometimes too much estrogen causes this bleeding and you need to back it off, or too much progesterone causes too thin of a lining and you need to back that off or increase your estrogen. So if this video helped you feel informed instead of afraid, please make sure that you like, subscribe, and share it with other women who need clarity. Postmenopausal bleeding deserves attention, not fear, silence, or dismissal. So I'll see you in the next video.